I want to quickly do some introductions before we get started, because this type of presentation often also draws our members who are living out of state. And so I want to welcome you to a special presentation from the Healthcare Authority on the healthcare plans that are managed by the Public Employees Benefits Board. I'm Lori Widener. I'm the Executive Director of RPEC. And also joining us today is Derek Van Spoor, who is our Associate Director for RPEC. And Derek and I will be monitoring chat and will be facilitating today's presentation with Ellen Wolfhagen. I think that Ellen doesn't need an introduction. Many of you have reached out to Ellen over the years, and she's been a wonderful partner with RPEC in sharing information about the plans so that our members are well informed and can pick plans that best meet their needs. Ellen serves as the Senior Account Manager for HCA, and her area of specialty is in Medicare. So Ellen, I'm going to turn the presentation to you. I wonder if you can, as we get started, if you'd like to also address how you would like our members to handle questions, whether you'd like them held at the end or whether you want to take them at different junctures in the presentation. So let us know what your preference is and we'll make that happen. So with that, I'm going to turn the presentation to Ellen.
Thanks so much, Lori. I appreciate the introduction. And I am absolutely comfortable with interruptions. So I won't be able to see people's hands being raised. Lori, if you could track that, but feel free to interrupt me and pose questions, because it's easier, you know, when the slide is right there than to try to go back and find them. Let me start by saying any technical difficulties here are all my fault. So I'll try to make things smooth and easy, but bear with me, 2 screens, etc. So today I'm going to talk about PEBB and Medicare and how Medicare works specifically with the PEBB program, which is different than commercial market. I'll go through some of the retiree medical plan options, and we'll talk about dental options, and then I have some resources for you, and then we'll have a time at the end for more questions and answers. And Lori has promised that she and Derek are monitoring the chat, so if questions come up and are put into the chat, we will address those when we get there. So generally speaking, PEBB and Medicare, you must be enrolled in Medicare Part A and Medicare Part B to be enrolled in a Medicare plan under PEBB. Medicare Part A is for hospital and inpatient services. Medicare Part B is for doctors, specialists, durable medical equipment, and some vaccines, as well as some other things. You have to pay your Medicare Part B premium directly to Medicare. That is separate and apart from what you pay to HCA as your premium. And HCA offers different types of Medicare plans, and each works differently with Medicare. So we're going to spend some time going through that. The different plan types that we offer are coordination of benefits. That means that traditional Medicare, which is referred to Medicare Part A and Medicare Part B, sometimes called traditional Medicare or original Medicare, and those operate on a fee-for-service basis. Those are pay primary for medical services under coordination of benefits, and the plans pay pharmacy claims differently. For the PEBB portfolio, our coordination of benefits plans offer creditable drug coverage. Creditable drug coverage is a term of art, and it means drug coverage that's at least as good as Part D coverage from Medicare, but it is not a Medicare Part D plan. We also offer Medicare Advantage plans. These are employer group waiver plans. These are different from the commercial market. They can be either HMO plans, health maintenance organization, or they can be PPO, Preferred Provider Organization plans. They can include creditable drug coverage or Part D coverage. If Part D is included, the plan is called an MAPD for Medicare Advantage, including Part D. And again, there's a difference between Part D plans and creditable drug coverage. In order to control costs, the federal government says your drug coverage has to be at least as good as what's offered by a Part D plan, and that's what creditable drug coverage is. The final kinds of plans that we offer are Medicare supplement plans. These are sometimes called Medigap plans. These are designed to cover the copays for Medicare covered services. Again, Medicare Part A and Medicare Part B. They do not cover anything that Medicare does not cover, and they offer no drug coverage. If you take these plans, you have to get a Part D plan from the commercial market. Here are the plans by type. Coordination of benefits is UMP Classic Medicare, which includes a coordination of benefits bank, a COB bank, and I'll talk more about that in a minute. Kaiser Permanente Washington Original Medicare is also a coordination of benefits plan, but it does not have a COB bank. For Medicare Advantage, we have Kaiser Permanente Northwest Senior Advantage. That's available in Southwest Washington. Kaiser Washington KP offers the Medicare Advantage plan. United Healthcare offers PEBB Complete and PEBB Balance. Those are MAPD plans. Again, those are Medicare Advantage plans that include Part D prescription drug coverage. For Medicare Supplement, we have Premera Plan F, which is closed to enrollment, and Premera Plan G. In terms of how the plans work, did somebody have a question? In terms of how the plans work, for UMP Classic, it acts as a full secondary insurance to Medicare. It's very expensive, but it's very rich and offers lots of credibility. Aruna? Aruna, I see you have a question.
Yes, good morning, thank you. My question was, if person turned 65 before 2020 January, can they get Plan F
This meeting is being
supplement?
recorded.
So they would have to have been enrolled in Plan F before January 1, 2020. It's not just turning 65. They'd have to have been enrolled before January 1, 2020. It is closed for new enrollments.
Thank you.
Ellen, we have one other question from Darlene.
Sure.
Well, excuse me, this is Jose, not Darlene. Jose Palmas. I'm also a retiree. Ma'am, you mentioned at the beginning that the PEBB Advantage plans are different from the commercial Advantage plans. If my question is accurate, can you please explain how they're different?
Yes. So as I get into the specific plans, I will tell you what the differences are between the commercial market and the PEBB plans. Will that address your question?
Yes, thank you.
Okay. So again, going through the specific plans, the UMP Classic, because of the COB bank, if you use a lot of medical services, the plan takes the money that it saves between what Medicare would pay for services and what they would pay, and accrues that in a bank, and that bank is used to pay you back for any out-of-pocket expenses that you may have. And again, that COB bank is only in UMP Classic. And the plans include, as I said before, creditable drug coverage. For the Medicare Advantage plans, Kaiser plans are all HMO plans. They're regional. You must live within a specific service area. And Kaiser offers a closed network with limited exceptions for out-of-network services. I see Stephanie has your hand raised.
Hi, and good morning. I'm a retiree with Medicare. My spouse is not Medicare eligible, and UMP is the only option. So when you were going through the UMP classic aspects, and yeah, it looks like bullet 3 maybe. Is that also true for a non-Medicare spouse, that all the out-of-pocket expenses will be covered?
No, those expenses are limited to the person who's on the Medicare part of the plan,
Thank you.
because it has to do with Medicare offsetting those costs. For the Kaiser Medicare plans, they also include creditable drug coverage. So some of the differences between the commercial market and the Kaiser plans that we have to do with how the drug coverage works and what some of the benefits are. The biggest difference between the commercial market and the PEBB offerings are on the MAPD plans. So for the MAPD plans, these are group Medicare Advantage PPO plans. And that phrase, group Medicare Advantage PPO, is very important. What it means is these are plans that were negotiated by an employer group. That's what PEBB is. And it's a PPO plan. So these are preferred provider organization plans. They have much more flexibility than an HMO plan. And the difference for a group Medicare Advantage plan is the group can negotiate benefits, formularies, and coverage that are different than on the commercial market. And I'll talk a little bit more about the commercial market in a little bit as well. Under the MAPD plans, you can see any provider who takes Medicare and accepts the plan. There's no difference in copay between in-network providers and out-of-network providers. Reimbursement for Medicare covered services, should the provider not bill United directly, is limited to the Medicare allowed amount, less the copay if there is any. So if the provider doesn't want to bill United directly, you can still see them. You have to pay up front and get reimbursement. And the reimbursement is limited to the Medicare allowed amount. United can work with people if there is balance billing, because the provider really should not be charging balance billing for Medicare services. For non-Medicare covered services, such as massage, the reimbursement is at 100% of the billed charges, less a copay if there is any. These plans are nationwide. They provide coverage for non-emergencies internationally. Let me take a minute to speak about how Medicare works with international travel. If you have an emergency, that means something that's life-threatening or needs immediate medical attention, for example, breaking a leg. Medicare covers those services internationally. You have to pay upfront for those services, but you get reimbursed. So Medicare covers emergency services, and those are true under any single plan that the PEBB portfolio has. For non-Medicare, for non-emergency services, Medicare does not cover those. Only UMP, Classic, and the MAPD plans cover non-emergency services. So that means you're sick, you need a doctor, but you don't have to go to the hospital. It's not life-threatening. You can, again, you have to pay up front, but you can get reimbursed from either if you're in UMP Classic or if you are in the MAPD plan, you can get reimbursed for those costs. The MAPD plans, as I said earlier, include Part D pharmacy coverage. Linda?
Would you repeat the 3 places where non-emergency is covered?
Yes, non-emergency. So this is just international, right? This is not non-emergencies that happen statewide, but or in the United States. Emergency, non-emergency care is covered only by UMP Classic and the MAPD plans.
Okay.
Sandra?
Give another, good, perfect.
Thank you.
Sandra, you're on mute.
Hi, this is Christine Clark. Am I the next one to ask a question?
Well, Sandra had her hand raised and was on
Okay.
mute, and I don't know what happened to her.
Right.
So Christine, go ahead.
Okay, if I have to travel internationally for a heart surgery for my rare condition, then I could go, for instance, to Greece to have that surgery.
If you are on Medicare, you would have to get that approved by Medicare, whether you're on any of these plans, it doesn't matter. That kind of thing where you're claiming the only place that you can get that surgery is in another country has to be pre-approved by Medicare.
Okay, thank you.
Uh-huh.
And
Sandra?
Sandra is back.
Thanks. I had my mute on. I have a little bit of a different situation. My primary is the VA clinic, the Veterans Clinic in Silverdale, and my primary physician is there. But I also carry United Healthcare. Now, all of my prescriptions obviously are free through the VA that are written by hospital or anybody that's a provider. I keep United Healthcare because I want to take advantage of the massages and those kinds of things, chiropractic. So, which is what the VA doesn't pay for. So I got MAPD now, but I'm kind of paying more for the prescription part that I'm never going to use. Do you have any insight as to how I might manage that better?
Unfortunately, because the services that you want, massage, chiropractic, et cetera, are not covered by Medicare, there really is no, you need a Medicare Advantage plan to cover those, or UMP Classic to cover those, because they're not Medicare services. You know, the most reasonable plans that are available would be the MAPDs that cover those services. So yes, a portion of your premium is covering the drug piece of that, but there's really no
way to get
other
around it.
option. Right. Sorry.
All right, well, that
Ellen?
answers.
Thank you. Ellen, we've got 2 questions in chat.
Okay.
So the first one is United Healthcare complete and MAPD?
Yes, both of the United Healthcare plans are MAPD plans. Medicare Advantage, including Part D prescription coverage.
Okay. The next is if you move to another country but remain a US citizen, will the service be approved?
So if you live outside of the United States for more than 6 months, you lose your Medicare eligibility. So it's very important to understand the ins and outs of what happens with Medicare. There are some exceptions in certain countries working with certain embassies, and that for that question, I would refer you to the Medicare office, which is Social Security Administration. You need to get an answer directly from them.
Thank you.
Uh-huh.
Just checking. I don't see any other questions.
Okay, I'm going to move on. The MAPD plans, so this is PEB Complete or PEB Balance. Again, these are group Medicare Advantage plans. Oh, I think I've covered all of them. Okay, moving on. The Medicare Supplement plans, again, these are sometimes called Medigap plans. And the reason is they cover the gap that Medicare does not pay. Remember, Medicare pays 80%. And these plans cover the 20% gap. Plan F is closed. Linda has a hand up.
Yeah, I'm having a hard time getting all of this written down. Will you send us a copy of these?
Yes,
Yeah.
the slides are being distributed by Lori.
Yeah, so just to bring this back around, there is a special page that you will find as soon as you go to the RPEC website. It's the Guide to Open Enrollment. You have been receiving that link for the last couple of weeks in the newsflash. On that page, you'll find, as soon as we are able, a link to this presentation. Ellen's PowerPoint is there. You are aware, I think, if you read those news flashes, that there's a 3-part series that we did some weeks ago with Matt Groshong and with Tim Smolin, who's with Sheba. So there's a 3-part series that you can watch that provides a lot of detail. All of the helpful resources that Ellen and her team have put together, you'll find links on that one-stop page as soon as you go to the RPEC website. And those links have been placed in the chat if you know how to access chat. If you don't, just go to www.rpecwa.org. And as soon as you go to that website, the RPEC website, you'll see how to access the Guide to Open Enrollment. And it's a page there with all these resources.
Great, thank you very much.
Thank you. I appreciate that there's a lot of information on these slides, so I'm very glad that everybody will have them to look through at your leisure. There's good information, but it takes a lot to absorb it all. So,
Ellen, may I just ask one more point of clarification?
Yes.
We had a member asked if chiropractic was covered by Medicare. Could you repeat that, please?
So chiropractic services are covered in limited circumstances by Medicare. So it has to be a certain kind of diagnosis to be covered. And I suggest that you go to Medicare. You can go to medicare.gov and put in information and ask us a specific question, because it really depends on the exact diagnosis code that's covered.
So one other question just came in. I have the person, Casey has indicated, I have Kaiser Washington Medicare, and on my letter from PEB for open enrollment for the 2024 premium, it says not valid. Is that not available?
It is available. It was an error in the transmission of those letters. Those letters are being corrected and being resent. So anybody who got not valid and Kaiser Medicare, please look for another letter that will be coming soon.
And we can put that out as well. We've got a hand raised from Stephanie.
Hi, can you put in really simple terms the difference between Medicare supplemental plan and Medicare Advantage? It's not sticking in my brain, and I want a little help there.
So a Medicare supplement plan or UMP Classic, those act as additional insurance on top of your Medicare. Okay, that's the simplest way to explain that. The Medicare Advantage is a different structure for the coverage. In Medicare Advantage, the carrier has assumed the responsibility for determining what coverage you need, when and where and how you get it. So that's the simplest explanation I can give you. Does that address your question?
No, not exactly. I got the supplemental, what that means, but by carrier, you mean the,
company that's providing the insurance. So in our case, it would be either Kaiser or United.
it assumes responsibility for what?
For what kind of coverage you get, where you get that coverage, and when. So for
So-
example,
Sorry.
If there is a need for prior authorization or, in the supplement plans, you can pick any provider who accepts Medicare and go there. In the Medicare Advantage plans, you have a primary care physician, and although you don't need referrals in some plans do require referrals. There are differences for how those benefits are controlled, and that's up to the carrier, the company that is providing the Medicare Advantage plan.
Last question about that, Ellen, and thank you, is there available to us a side-by-side comparison? Rather than this last year, we ended up being shocked by what was covered and not covered by United Healthcare, and frankly, I can't get through the 100-page booklet.
Unfortunately, we don't have a comprehensive plan comparison that gives every little bit of coverage. I can answer specific questions. I'll give you a email address, HCA PEBB Medicare at hca.wa.gov, and I have that in the slides, and Lori can put that in the chat as well. If you have specific questions, but there are so many different types of coverage and so many different situations that we can only provide a benefits at a glance comparison, and we do have that up on the HCA website at this point. So, you can see more of a side-by-side comparison, but it will not be absolutely comprehensive. The only way to do that is to read through the certificates of coverage.
Thanks. Final question on that. Is there, sorry. Sorry, I'll come back to that. I have a stage 4 cancer, and it's in the brain, so it affects my thinking. So my apologies. I'll come back to it or put it in the chat, the follow up on that.
Ellen, thank you so much. Ellen, we've got a number of questions in the chat, and then we've got Aruna's hand raised. So let's go to some of the chat questions, if you're okay with that.
Sure.
Okay. So one member has asked, Ellen, please give examples of what additional services supplemental plans F and G cover versus plain Medicare.
So Plan F and Plan G are Medigap plans. They cover only what Medicare covers. So there are no additional services.
Okay. And let me just pull this up for a second. Another question here. My physician is part of the Family Care Network in Northwest Washington. They are a Medicare provider. However, they have recently changed their policy towards billing UHC. Effective January 1st, they will not have anything to do with UHC. I told them I am perfectly willing to pay out of pocket for services at the Medicare rate and seek reimbursement from UHC. However, they are unwilling to bill me directly. As a Medicare provider, are there any federal Medicare policies that require the clinic to bill clients directly?
I am not aware of any policies that require that. I would ask that question of Medicare, Medicare.gov, or call your local Social Security Administration. Unfortunately, I don't know all the ins and outs of the Medicare policies, and I don't know how they would deal with that.
Another question, is the $240 the new deductible for Medicare from our Social Security?
So it's a Part B deductible. I don't believe it gets paid automatically from your Social Security. You have to work with the Social Security Administration to determine how you're going to pay your Part B premium.
Thank you. And now we'll go to Aruna. Aruna?
I think for Darlene's question, if I understand right, Medicare supplement plan or Medigap plan is very similar to Uniform Medical Plan, where you can go to any physician you want to go to. And Medicare pays for 80% of your charges after you have met the deductible. And, Medigap plan, if you're on Plan G, then after you meet that deductible, you pay for everything that Medicare would cover. And there is no pre-authorization or select network of people or any delays or denial. So Medicare supplement plan, if I understand right, Ellen, is very similar to Uniform Medical, but it does not have prescription plan for the drugs, and it doesn't pay for chiropractor, massage therapist, and acupuncture. Is that
And
correct?
it doesn't cover, that is correct. It doesn't cover vision. It doesn't cover hearing. And it is important to note, Aruna, that if prior authorization is required by Medicare, whether you're on UMP, whether you're on Plan G, Plan F, doesn't matter. Medicare has those prior authorization requirements.
But that is prior authorization. If you have, say, chiropractor request, then there is a specific diagnosis code, because typically Medicare doesn't pay for chiropractor.
Correct.
Other than that, except for massage therapy, acupuncture, and chiropractor, under special circumstances, Medigap plan is very similar to
Yes.
your medical plan, except you have to have a separate prescription drug plan in addition to the supplement. And you don't,
Yes.
and another thing is Uniform Medical Plan has additional deductible after you have deductible for Medicare. There is additional deductible for healthcare as well as for prescription drugs too, correct?
So there is $100 deductible for prescription drug coverage, but we'll go into that in a little bit. If you can just hold off so that I can get through the slides.
Ellen?
Yes.
So a couple of things. We've got a hand raised with Matt. Matt, let's get to you in just a minute. We've got a couple questions that have fallen into chat, or statements that have fallen into chat. So the first one is, let me get this big so I can read it. Which plans are required to follow Medicare guidelines and which ones are not?
So all of the plans have to follow Medicare guidelines for medical services.
Okay. Next, one of our members writes that she's interested in Primera G. There's HCA webinars on the other plan offerings, but she did not find one on G. And so I'm just wondering, is that something that may have been missed? Is there a webinar on Primera G?
I don't know that there's a webinar on Plan G. However, we do have a lot of in-person benefit fairs coming up, and Primera is going to be there, and they have lots of information. And if I could actually work through the end of this slide, I will tell you that Primera offers, not as part of Plan G benefits, but as a member of the Primera family, if you will. If you are on Plan G, you have access to discounts that are available to Primera on hearing aids, gym membership, and a variety of other services. And there'll be plenty of information about that at the benefits fairs as well.
And let me add, I shared this earlier, it is in chat. RPEC, in concert with WEA Retired, we developed, and Matt Groshong, who is the chair of our healthcare work group, is joining us today as well. We developed a 3-part series with Sheba. A great deal of information in that 3-part webinar series deals with Primera Plan G. And so we would encourage you to go to those links. They are on the guide to open enrollment, which you'll find front and center on the RPEC website, and Derek and I will put that link back in the chat. So there's some great resources there as well, and we would encourage you to listen to the webinar. It's done in a conversational style, and I think the content is very easy to follow and may answer many of your questions. I want to just, going back to chat, that one of our members mentioned that she regularly has chiropractic treatments. Then she's never had chiropractic treatments refused by Medicare. She has classic Medicare with Primera supplement. There needs to be a reason for those treatments. And then another member writes that they signed up for Uniform in the 90s and were told that if they ever left Uniform, they would never be able to go back to that plan. I think the answer is, Ellen, can they go back to that plan?
Yes, you can go back to that plan. So
Yes, they can.
that was something in the early 90s before other plan options became available, and in PEBB, and we'll get to this in the slides, one of the advantages of being in PEBB is that you can switch Medicare plans every open enrollment, and you can switch back to UMP, or you can take Plan G or back and forth and get out of Medicare Advantage into Medicare Advantage, whatever.
So we have two more, one in chat, and then we'll go to Matt. So the comment in chat has to do with essentially the customer service evaluation of the different plan options. And I know we've covered this in the past. This is of high interest to our members. They're interested in knowing how other retirees, what their experience has been with these plans. So are there websites, or is there any information that would give our members a sense of the capability of the customer service and the kind of service that subscribers
Unfortunately,
receive?
the kinds of requirements that we have on customer service have to do with things like speed of answer and how many calls get abandoned and things like that. We don't have a good way of assessing what I hear as customer concerns, where I felt like I got wrong information, or I felt like it took too long, or I didn't get proper information. My suggestion would be the HCA PEBB Medicare email place is a good place to say, hey, I'm having a problem with customer service. It's the only way that I can go back to the plans and say, can you address this? I know that's not the most satisfactory answer, but that's the answer that I have.
So let's take Matt's question, and I'm going to hold the remaining that have come in for the chat so that Ellen can just move a little further in her presentation. So just know that if you've placed a question in chat, we'll get to it in just a moment when there's a natural break in Ellen's presentation. And Matt, why don't you go ahead and ask your question?
Yes. Hi, Ellen. Thank you. And I have some follow-up questions that I think are really important for folks to hear, and me too. It's an incredibly complex arena, this healthcare stuff. And it's around the family care network situation and out of network, and that hospitals saying they don't want to work with United Healthcare in general. And I can ask them now, but would it be better if I waited until the open question time?
If you don't mind, Matt, that would be better. Thank you. Okay. So this may address some of the questions. Who determines the network? So HCA does not do any direct provider contracting. And each of the plans, including UMP, which is the Regions Network, they do their own network contracting and providing. So when we talk about in-network providers, those are providers who have a direct contract with the company. Out of network means either they don't have a contract, but the provider is willing to accept the plan, or they're completely out of network and are not willing to accept the plan. So providers can leave or join a network. They have to give us adequate notice, but HCA is really a not a party to the direct contracting. We are just a receiver, if you will. Now, in some situations, the providers themselves and the carrier have asked HCA to participate in the discussions that happened with Regents and the Evergreen Polyclinic situation. In terms of family healthcare was never in network with United, so we do not have a direct contracting relationship with family care, and so it's more difficult to have negotiations with family care because they've never been part of a direct relationship. So hopefully, Matt, is this when you want to ask your question?
Part of it, sure. I'll try to keep this part of it as clear as possible. There seem to be two areas where that a provider can say no to United Healthcare, for example. They can say, you're out of network. But then there's the nuclear option, which is, we will not bill you. And so if you could answer that, and then I have a follow-up question.
So you are out of network, you can still see them. If they are willing to bill United directly, then you won't see a bill at all. It's important to note that sometimes providers say, we are out of network, we will not work with United, but upon further investigation, we find out that they are submitting claims to United. So there's a misunderstanding either in the billing office or the provider themselves in the relationship with United. Sometimes it's because they don't deal with commercial plans with United, but because our plan is a group Medicare Advantage PPO plan, they do work with our plan. The second part of it was the nuclear option, if you will, that we won't have anything to do with United. So the member has a choice. They can see the provider, get a bill, and submit that bill for reimbursement directly to United. Remember that if it's a Medicare covered service, it's reimbursed at the Medicare approved amount.
Ellen, I'm going to have a question. Oh, go ahead, Matt.
Yeah, a follow-up. So that's actually an important thing, I think, for us to understand. And you alluded to it in a previous slide, that if somebody goes, well, I want to switch plans from, let's say, Uniform Medical Plan to PEBB Complete, and I want to stay with my doctor, and they and that doctor at some point uses the nuclear option and says, no, I'm not going to bill United Healthcare, and you submit it yourself, well, the provider is going to probably bill at the retail rate and not the Medicare rate. And that can be a really wide difference. I don't know if it's quite balanced billing. It's simply billing at the retail rate. Oh, what do you do then when you get that?
So if it's for Medicare allowed services, they're really not supposed to do that. One of the agreements of Medicare is that you're not going to balance billing, you're not going to charge at the retail rate, if you will. So you can have, if you're a member of the United Healthcare plan, you can ask United to intervene for you, and they will. They will approach the provider. So that is important to remember. And it's all, I do want to stress again that while your provider may leave in the middle of the year, there is coverage for the rest of that year because of the agreements that we have with the carriers to make sure that that's covered. But at the beginning of the following year, providers can be in or out of network.
Ellen, one more question that's kind of related to this. I think that it's been answered. So Sandy had put in chat earlier, what's the reason that providers refuse UHC plans? And is this a problematic issue? And that's what we've been talking about. Sandra, excuse me, has your question been sufficiently answered?
Yes, I think it did. Thank you, Lori.
And Lori, I just want to do a time check. How long do we have to go? We might have to go to noon. That's why I'm trying to find out, or 11:30.
Yeah, we actually scheduled
Okay.
this from 10 to 12, knowing that
Perfect.
our members had lots of questions. It's currently
Perfect.
10:45.
Okay, great. Thank you.
All right, so
Okay.
we're going to pause on questions and let Ellen click through a couple more of her frames. Thanks, Ellen.
Sure.
Appreciate the questions, everyone.
So some of the considerations that you should think about if you're making a plan choice. You know, coverage. What kind of coverage is there? Do I want additional benefits such as chiropractic, acupuncture, naturopathy? Do I want vision and hearing covered? Do I want gym membership? Those are the kinds of coverage questions. What are the costs? It's not just premium costs. Remember, you have to look at out-of-pocket costs, co-pays. You know, what am I going to spend in the course of a year? And what can I afford? And then convenience. Are there providers and facilities where you go, where you live, where you might travel? Do I have coverage out of state? Do I have coverage nationwide? What if I want to go on trips? What if I'm going internationally? These are the kinds of things that you need to think about. Are there any network limitations? What happens if I see somebody outside of the network? Some plans have differences in copays for out-of-network providers, so it's important to understand those things. And then finally, continuity of coverage. If I am currently under a care plan, I'm very comfortable with my provider, change may not be the right choice. So, you know, there is no requirement to change. And again, if you do decide to make a change within PEBB, during open enrollment, you can switch from any Medicare plan to any other kind of Medicare plan.
Ellen,
Here's the money shot, if you will. Yeah.
I'm going to let me know when you're, maybe get through this next couple, and then we'll pick up some of the questions that are falling into chat.
Sure.
Okay. So just signal me when you're ready, because there's quite a few.
Sure. Okay. So let me get through the premiums, Lori, and then we'll take a break and go back and answer questions. So here are the premiums. I'm not going to read them all to you, but you will see that the low is Plan G at $101.99, and the high is UMP Classic at $532.94. And the difference has to do with the structure of the plans and sort of what other pots of money might be available to the plans to lower premium costs. The other slide that I think is important is this one, which is if you and your spouse are on a single account and want to determine what the premiums would be, here are the calculations. So it's 2 times the single subscriber rate less $5.96. Why? Because that $5.96 is an administrative fee that HCA adds so that we can administer these plans for you. And we charge it only once per account. So if you're in a combined account, it only gets charged once. Let me make a couple of things clear. First of all, these rates that are shown right now assume that both the subscriber and the spouse are on Medicare A and Medicare B. So that's an assumption that has to be met. The second is that these rates and the rates on the previous slide for single subscriber are all after the application of the Medicare explicit subsidy. The Medicare explicit subsidy is a state enacted fund, if you will, that lowers premiums for Medicare retirees. It only applies to Medicare retirees. That's why it's the Medicare explicit subsidy. And how it works is the bid premium that the carriers provide to HCA is lowered by $183 or 50% of the premium, whichever is less. So these premiums shown are after the application of that 183 or 50% of the premium, whichever is less. So Lori, this might be a good place to stop and take some questions.
Perfect. Okay. So this is just this is a point of clarification. If my provider refuses to deal with Medicare, can the patient submit the bill to Medicare and have it reimbursed for a medical service? I guess that should, and the adding would be that a medical service that is Medicare eligible.
If it's Medicare eligible, you have to see a Medicare provider. If Medicare denied it because the provider's not participating in Medicare, I don't believe that you can submit a bill directly to Medicare for it.
Okay, and what if the medical service is not Medicare approved?
So if the medical service is not covered by Medicare, only the plans that have additional benefits would provide any coverage for that. So for example, in Plan G, it's Medicare only services. So if Medicare denied the claim because it's not a Medicare covered service, the Plan G would not give you any money towards it.
So that question came from Elliot. Does that answer your question? Maybe you could put that in chat for me. I'm going to move on to the next question. What company is offering PEBB Complete and Balance?
United Healthcare.
Okay, thank you. Please mention how the drug discount cards are used if you are covered by a Part D plan.
So I have more information coming up about the pharmacy coverage, but I will just say, generally speaking, on a Part D plan, the drug discount cards are not allowed to be used as well because the Part D has already taken advantage of all the manufacturer rebates, and that's what's driven down the cost of the Part D coverage.
Got it. Okay. Does mental health mental health service, okay. Does mental health service parity apply to PEBB plans? How is it enforced?
So mental health parity applies to the plans for active employees or the employer-sponsored plans. And I'm not going to speak to how it's enforced, but it does not apply generally to retiree-only plans.
Is there any hope that UMP will ever have subsidies like the other plans for
So
a
that
more
would
reasonably monthly cost?
Sorry. That would require a change in the structure of that plan. And that is something that is being researched right now. Is there a possible change in structure that would allow UMP to take advantage of those subsidies?
Perfect. We've had this before and you started to cover this. I'm sure your presentation will get more into it. You mentioned about the cost in the plans is based on how they are structured, but the question is, why is UMP premium so high compared to the PEBB, the other PEBB options?
So UMP Classic is a very unique kind of plan, and it does not meet the requirements for some of the federal subsidies. So that money is not available to UMP, and UMP is self-insured by the state of Washington. And so the costs are very, very high, and the costs are related to the claims experience that happens. In terms of medical benefits, Medicare does supplement some of that coverage because Medicare pays primary, but the difference in the other plans is that Medicare is backing almost all of the costs of the plan, and that lowers the premiums for those other plans.
And I'll just mention quickly that for those who read our newsletter or who read our weekly news flashes, you will know that RPEC is actively involved at a federal level trying to extend the federal prescription drug subsidies to plans like UMP Classic Medicare in order to make those plans more affordable for our members. Okay, I'm going to keep going with questions here.
Linda also has her hand raised, Linda Paxton, so just,
Maybe we get through these real quick and then we'll go to Linda.
okay.
So this member is on UHC. Okay. It says my VA doctor will write a referral if I can obtain a service quicker than through the VA administration community services. Does Ellen know if this creates a problem when working with employee sponsored plans? And this plan has to do with UHC.
Yeah, I'm so sorry. That's a little bit more specific than I can really get into because of the interaction between VA and Medicare, and I really don't have an answer for that. If you'd like to submit it to HCA PEBB Medicare, that email address, I can research it.
So Ellen, I'm going to ask this question. Later on in the presentation, do you delve into drug coverage?
Yes.
Okay, so maybe we pick this up later. It has to do with array drug coverage and how that works. Or do you want to address that now?
Let's hold that, if you don't mind, until we
Okay.
do the prescriptions.
All right, I'll try to come back to that.
Mhm.
And there's also a question about the drug coupons. We'll come back to that. I think we covered this, but if the question was already about mental health parity. Does Medicare cover mental health parity?
So that question doesn't really make sense. That mental health parity is not a covered thing. It means treating mental health services equally with physical services, and Medicare does cover mental health services. Let me also let you know that in 2024, Medicare has expanded the kinds of therapists that are available, which should provide more access for people who are on Medicare. So licensed marriage and family therapists will now be able to bill Medicare for their services starting in 2024.
Thank you. We've got a number of questions that relate to drug coverage, so let's wait on that. There was a question about, and it relates back to the cost of premiums, Ellen, and this one has to do with if the pool of subscribers drops in any specific plan, the cost per sticker tends to increase. That was a response that came from Derek. Sorry, Derek, I read your response. How do members dropping and changing from other plans increase the cost of UMP?
So if there are members who drop, so let me talk a little bit about a risk pool. A risk pool is a way of assessing the health needs of a particular population. So if the people who are enrolled in UMP Classic, for example, if the people who use fewer services switch out of that plan, who's left in the plan? The people who use more services. And the people who use more services tend to drive up the cost. If there are fewer of them, that means there are fewer people to pay for those higher costs, and that's going to increase premiums.
Okay. So I think maybe we hold this. There's a question about UMP, but I'd like to have us go back into the presentation for now. And there is one question that was asked. There was a hand raised.
Yeah,
so
Linda has her hand up.
Linda, why don't you go forward?
And unmute. Thank you very much. Ellen has answered some of my question, but I'm still stymied about the cost of UMP. And I understand that the federal government, supports and feeds into the other plans, but not UMP. And then the other question that was just asked was, had was also, I think, related to this. What is HCA doing about it? Why are they recommending that that you drop the plan?
We're not recommending that you drop the plan. If you like UMP, you should stay in UMP. UMP is open and continues to be the best plan out there. If you are comfortable, not everybody can afford it, but if you can afford it, then don't change.
Well, I've been with UMP since I started with Washington State. And it's not gone up that much. It's always been a little more expensive, but it's just, I mean, going up over $100 for the last 2 years, it's making it very difficult for a retiree to be able to afford it. And yet that's when you need those services.
We understand that, and we are working, as I said, HCA is researching right now structural plan changes that would make it possible to lower the premiums. Unfortunately, that's not available for 2024 yet, but we are working on it.
Okay.
And I put some other information in chat regarding UMP, if that's beneficial to folks and may answer some questions. Much of what we're talking about, we've been covering this in our news flashes. It's also been covered in our newsletters, and there's information on our websites. And we're very happy to, I'm happy to have a side conversation with you, as is Derek. So please know that information is available, and we'll be happy to share more.
Thank you, Lori. And thank you, Ellen. Good presentation.
Thanks. Jose has his hand up.
Thank you. I just wanted to ask whether I heard correctly that the subsidy that the UMP Classic members are not receiving is the drug subsidy. Is that, did I hear correctly, or did I mishear?
No, unfortunately. So the structure of the plan, there are some plans like Medicare Advantage plans that receive federal subsidies. That's different than the drug subsidy, and that's different than the Medicare explicit subsidy that lowers premiums in Washington State. So UMP takes advantage of the what's called the retiree drug subsidy that does help in UMP. And UMP members also have their premiums lowered by the Medicare explicit subsidy.
Okay, thank you.
I will just mention real quickly, I know Ellen's going to talk about the different plans and will give us some insights about how to compare them. I've referenced the 3-part series a couple of times. It's again in the chat. The second webinar in that series is all about the nuances in the plans. So if you haven't gotten enough through what Ellen's sharing today, there is much more on the RPEC website. And again, the link is in chat.
That's a great transition for me. Lori, thank you. This is a segue into some of the benefit comparisons. So as I said, you know, I'm not really capable of giving a blow-by-blow every single type of benefit and comparing them, but I do want to give you some familiarity and some comfort on a fairly high level. So this chart shows the different types of plans and some of the things that they do cover and some of the things that they don't cover. So it's important to note in nationwide coverage, UMP Classic is a nationwide plan, but the Kaiser plan is not. The Kaiser Original Medicare. And you can see that the Kaiser Medicare Advantage plans are not nationwide, but the United Healthcare plans are, and Premera Plan G is also nationwide. There's information on medical deductibles, pharmacy deductibles, hearing aids, glasses, massage therapy, gym membership, and drug coverage. Again, this is just very high level. This is sort of at a glance. It's meant to be an introduction to the plans. You can use this chart to decide if you're interested in one of the plans and find out more information. This is very intentionally labeled some benefits because it's only some benefits. However, these benefits are the things that I'm asked about most often. So hospital coverage, primary care coverage, specialists, outpatients, surgery, and naturopathy. Matt, I see your hand is up.
Yes. Isn't it true, Ellen, that the percentages that you see here, like 15% copays in UMP Classic Medicare for various services, do those percentages, they only apply up until the deductible is covered and then they're paid at 100%?
My understanding is that the copay still applies, but you get the money back through the COB savings bank. So I'm not sure that I would say it's only at the up to the deductible and then you pay 0%, because I believe that some providers still have the copay, but you get it back. So yes, you do not end up paying after the deductible as long as you've used enough services to use up that and have the savings bank to get money back from. Okay. One of the comments that has come up in a previous presentation is how come there are charges for hospital stay? I have Medicare Part A. I thought Medicare Part A pays all the hospital costs. While it's true that Medicare Part A pays the hospital costs, remember that Medicare Part A only pays 80% of the charges. So these copays apply to the amount that's not covered by Medicare. I also want to note on this that there's a difference between coinsurance, which is a percentage, which only UMP Classic Medicare has, and copays, which are flat dollar amounts. And again, everybody will get the slides so that they'll be able to look at this in detail later so that we can move on. In terms of the pharmacy benefits, you will see that there are some plans that have deductibles for pharmacy and some that don't. And maximum out of pocket, there are some plans that have a maximum out of pocket for pharmacy and some plans don't. This is something to consider when you're looking at the overall cost that you might end up paying through the year. No maximum out of pocket for pharmacy means there's no upward cap to limit your pharmacy expenses. Please note that the deductible for the MAPD plans applies to tiers 2, 3, and 4 only. And that's a good segue to this slide, which talks about the different tiers. So these don't line up exactly the same for every plan. It's up to the plan to determine the tiers, where things fall, and how they cover them. So it's not exactly apples to apples, but it is pretty easy to look at this and sort of figure out where things are. If you have specific drugs, it's very important to contact the plan that you're interested in and find out how it's covered, because the coverage changes depending on the formulation of the drug. It might be a cream is covered, but a lotion is not covered, or vice versa. It might be that a drug at a 20 milligram dosage is covered, but not a 40 milligram dosage, for example. So it's very important that you contact the plans specifically to find out exactly if they cover the drug in the particular formulation and dosage that you're interested in, and what tier that might be, and what the expected copays would be. Let me also note that for the MAPD plans, specialty drugs are covered, but they are covered only up to a 30-day supply at a time. You cannot get more than 30-day supply. And for all of the plans, there are mail order pharmacies, and you can get up to 90-day coverage, up to a 90-day supply through the mail order. In some of the plans, you can use mail order or retail. The United Healthcare plans offer 90-day supply through their preferred pharmacy for 2 times the 30-day copay. So there's a savings there. Kaiser has a similar arrangement. If you use their preferred provider for retail, for mail order services, you pay 2 times the copay, not 3 times the copay for a 90-day supply. And I know that there was a question about Array RX, I believe, Lori, if you wanted to bring that up now.
Okay, yeah, we've actually got a couple of questions that relate to pharmaceutical benefits. Okay. I'm gonna, give me a second here, and I'm gonna scroll through.
The question
So-
was from Sharon. Says, please explain how array drug coverage works.
So Array RX is the name of the drug coverage for UMP Classic, and I need more specific details on what you'd like to know about it. I'm not sure I know how to answer that question.
I think
Okay,
Sharon's trying to unmute.
Yeah, maybe while she's unmuting, we can ask you a different question regarding the drug coupons. Could you ask the pharmacy to not bill your Part D and use Good RX coupon in place of it if the coupon rate is better than the rate for the Part D?
Yes, I mean, you can choose not to process your claim through your Part D coverage. I'm not exactly sure, since you're like not using your Part D, I'm not exactly sure what Medicare does with that. So you would have the benefit of a coupon perhaps, but not any other benefit.
Okay,
Lori, Sharon has unmuted, so she
perfect.
can exemplify.
Okay,
Great.
okay. I'm asking that because like I was prescribed Protonics, instead of $100 a month, it's like $20 for 3 months through Array. It's just not clear to me. But then on Xarelto, it's cheaper to stay on the uniform coverage than go with Array. I'm just not clear how it all works together.
Sharon, I'm going to suggest that you send me a specific
Okay.
email on this so that I can look
Okay.
into it, because
Okay.
Array RX is UMP, so I have to find out
Oh.
exactly what's going on.
Oh, okay. Well, see, maybe that's my confusion. Okay, thank you.
So we have another question regarding prescription drug coverage, Ellen. Will the decrease in the prescription drug costs expected in 2024 and 2025 impact the UMP premium favorably?
So let me backtrack just a little bit. Those reduced drug costs, I think, are a reference to the Medicare negotiations that are going on as part of the Inflation Reduction Act. So the Inflation Reduction Act gave Medicare the authority to start negotiating with drug manufacturers to reduce the cost of certain drugs. Those drug costs are directly related only to Part D plans, right? Medicare is making this negotiation for the benefit of Part D Medicare plans. So to the extent that there are any negotiations that go on, they probably would not have an impact on UMP because it
Okay.
is not a Part D plan.
So there was a question about what happens to plans F and G subscribers who get a Plan D with respect to the drug benefit comparison chart.
So they're not listed on the drug comparison chart. You can see that Plan G is not here. And the reason is there are a variety of Part D plans that are available. And depending on the Part D plan that you take, that will determine what tier drugs are on and what the copays are. But since I don't know the entire range of plans that are out there or what plan you have chosen, I cannot predict what the plan copays would be or what the coverage is. That's why it's important to talk to the carrier for your specific plan and find out what the coverage limits are. I will also just put a plug in here for SHIBA, if I may. The SHIBA volunteers can really help you choose an individual Part D plan from the commercial market, and they can help you find the plan that best meets your own particular pharmacy needs.
So Ellen, you've already addressed this, but you may just want to repeat it. Someone has asked about UHC PEB Complete and getting more details about specific drug costs and coverage for 2024.
So
Where does a
is,
person go to get that information?
if you go to the United Healthcare website, retiree.uhc.wa/PEB, it may be WA PEB, all is one word. If you go there, there is a place to find drugs, and you can put in the specific drug and find out more about the costs.
Is that in your slide, Ellen?
It is not in my slide, unfortunately.
Okay, can you repeat that again and we'll try to put it into the chat? Or do you want
Lori,
to
if I can
pause?
get back to you for you to send it out
Sure.
to everybody, I
We'll be
want to
happy
be
to.
doubly sure. I'm sure it's UHC. I'm sorry. I believe it's retiree.uhc.wa/PEB. But again, I want to make doubly sure. So Lori, after this, I will get back to you. I can't look it up while I'm doing this.
No, we understand. And we'll add this information to that resource page that I've been talking about. And Derek and I have both been putting the link in chat. So you'll
Excellent.
see it there. You'll also see that Derek's added the contact for SHIBA, which was referenced before. We do have a couple of other questions that are not related to prescription drug coverage. So maybe we'll pick those up in just a bit. I'm going to check to see if there's any hands raised. I don't see any at this point. Ellen, do you want to proceed with the presentation, and we'll circle back on these other questions that are non-drug related?
Lori, I love how you give me the perfect segue for the next part of my presentation.
You would think that we rehearsed this, which we didn't.
You would. So I want to talk a little bit about dental coverage. So PEB offers dental coverage. It is separate from medical coverage. We have some managed care plans that's sort of similar to an HMO for medical. They do have a limited network, and there are service area restrictions. And then we have a PPO plan, which provides better coverage if you use a preferred provider, and slightly less coverage for a premier provider, but it has a very, very broad network. And in the PPO plan, unlike the medical plans, which tell you the maximum out-of-pocket that you're going to pay, on dental coverage, they tell you the plan maximum. So that's the coverage limit. That's the maximum amount that the plan will pay in a year. And why do I talk about dental coverage? You know, especially for this audience, it's very important because good oral care leads to good overall health care. And as we get older, there are more diseases that become more prevalent, like gum disease. And dentists can discover health conditions much earlier. Sometimes we don't get into our primary care provider except for once a year, but a dentist can help find situations that need immediate attention.
Ellen, while you're talking about the importance of dental coverage, can you also differentiate between Delta Dental and Uniform Dental Plan?
Yes, I'm going to in just a second. So again, perfect segue. The managed care plans that we have include Delta Care. So unfortunately, both of our plans, Delta Care and the Uniform Dental Plan, are administered by Delta Dental of Washington. And I know that that leads to some confusion, but it is really important for folks to understand that Delta Care is a managed care plan. So Delta Care has a limited network. It's Washington State only. And you must see a provider within that network. You get a primary care dentist assigned to you, and you have to get referrals to a specialist. Willamette Dental is the other plan that we have that's managed care. Willamette Dental has providers in Oregon and Idaho, as well as Washington State, but it is also a limited network. You have to see one of their providers. You do have a primary care dentist assigned to you, and you have to get a referral for specialists. The Uniform Dental Plan. So the Uniform Dental Plan is also administered by Delta Dental, but it is a nationwide plan. It's like a PPO plan, and it can be used with any medical plan. So you can be on Plan G and you can have UDP. You can be on one of the Medicare Advantage plans and still have UDP. And again, UDP has 2 tiers for reimbursement. One is for premier providers, which is slightly less, and the other is for preferred providers.
Ellen, we've got a couple dental questions. Do you mind taking them now?
No, this is perfect.
Okay, perfect. People who have MAPD won't need dental plans. Won't need a dental plan? Is that correct?
No, that is not correct. The MAPD plans, the Medicare Advantage plans that are available through PEBB do not have dental coverage. It is important to note that through PEBB, the only dental coverage that you get is if you take one of the dental plans through PEBB.
Perfect. Just a comment from a member who had a $2,500 out-of-pocket cost last year for dental and has just expressed the need for a comprehensive plan that keeps up with the progress made in the field. I'll just mention to all of you who are joining us today that dental was also discussed as part of the listening sessions that we coordinated in concert with HCA. And so I know that they are aware that this is a concern for retirees, and we're glad that that's actually why I think Ellen has put more emphasis on it this year in our presentation today.
Yes, and also it's important to note that the Uniform Dental Plan is self-insured just like the Uniform Medical Plan. And so we have to go to the legislature for money to pay the claims. So if we were, for example, to raise the limit, we'd have to get more money from the legislature in order to be able to do that. I see Elliot has her hand raised.
I would like to add here that HCA and PEBB did try to get additional benefits for our dental plans. I forget which ones, but there was a concerted effort. But the legislature didn't grant all of the additional benefits that HCA was striving for. So it's not like HCA can say, well, and Ellen alluded to this, HCA can say, well, we'll add some more benefits for kids. We need money from the legislature to cover it. And legislature has not covered all of HCA's requests. So I want to give them credit for really making a concerted effort to expand coverage of
Thank you,
certain
Ellen.
services.
Thank you, Elliot. I appreciate that. And in fact, we did have a suite of enhancements that we were asking for. Those would apply to the uniform dental plan. That's the only plan that we can make changes to. The other plans are managed care plans. So we did try to get money from the legislature for the uniform dental plan, and we're not successful last year, but we're going to keep pushing on it. So hopefully something will happen.
Last
see-
question for now has to do with if you're on a Plan G, can you still be on Delta Dental?
Yes, but let me again make sure that you understand Delta Dental is like the carrier. It's like Primera is the carrier for Plan G. You are either on Delta Care, which is the managed care plan, or you are on Uniform Dental Plan, which is administered by Delta Dental. So yes, you can be on Plan G and have the Uniform Dental Plan. I see Jose has his hand up.
Yes, thank you. We recently had an experience where it was recommended that we get dental implants. And if anybody has had experience, they are unbelievably expensive. And uniform dental would just cover a small portion. And the young lady at Uniform Dental made a suggestion that there may be cost savings if we, in addition to Uniform Dental, that we try to buy a dental plan on the market. Do you have any comment on that?
I don't. What we have through PEBB is the Uniform Dental Plan. I know that there are plans available on the commercial market, but I don't have any details about them.
Okay, I think you can proceed, Ellen. Thank
Okay,
you.
great, thank you. So here are the premiums for the dental plans. You can see that they're all very close in cost. Again, Delta Care and Willamette are managed care plans. It's very important. I cannot stress enough, Delta Care is a managed care plan. Even though it has the name Delta in it, it is not the preferred provider plan. And these premiums do not have an administrative fee. They also do not have any explicit subsidy. So if you were to cover 2 people, you just multiply this by 2. Now I'd like to transition, Lori, if that's okay.
Please do.
Okay. Why choose PEBB? So, you know, we've had a number of questions that have come up over the past year or so, and not just through listening sessions. So we get comments at board meetings, we get comments from general correspondence, we get comments to the HCA PEBB Medicare email box, and we look at all of these things. And there's a fair bit of confusion, I think, about what is PEBB and why should I be in PEBB. So a couple of things to note about that. PEBB is an employer group. So you can think of us like a union, except we're bigger than that because we cover all of the unions, if you will. And we consolidate the market basket. And so we can drive our negotiations. And this is the main reason that the PEBB plans, especially the Medicare plans, are different than what you can get on the commercial market. And one of the big benefits of being in PEBB is that we stand between you and the plan. So if you're having issues with the plan and need intervention, PEBB can do that. That's what the purpose of the HCA PEBB Medicare email box is. If situations are referred to us, we can interfere with the plan and find out what's going on and push for resolution. One of the biggest benefits and most important to you is that if you're in PEBB, unlike on the commercial market, you can switch Medicare plans every year. You can go back to traditional Medicare. You can switch from Medicare Advantage to a Medigap plan. You can switch from a Medigap plan to UMP. You can switch from UMP to Medigap. And that's a very important benefit. There's no restriction on rejoining a traditional Medicare plan. There is no medical exam required. There's no special underwriting required to go back to a traditional Medicare plan. And there's no extra fees for health condition or pre-existing condition fees. So those are things you might encounter on the commercial market that are not part of the PEB portfolio. So this is a big benefit. And again, you've heard it before, but I'll say it again. The PEB plans are richer and provide lower costs overall than anything that's available on the commercial market. So let me take a minute now to talk about, we are right smack in the middle of the federal Medicare open enrollment period. So you are hearing and seeing lots of ads, and a lot of those ads are geared to $0 premium, zero premium Medicare Advantage plans. Those plans are very, very different than what's available in PEB. And one of the biggest differences is those plans are mostly HMOs with limited networks. Those plans have specific requirements that have to be met. They have higher deductibles, they have higher copays, and most significantly, they have very high out-of-pocket limits, usually starting at about $5,000. So that's much more than anything that's available through PEB. So it's very important, if you have any questions, any concerns, and you're looking at ads and you want to know, why should I take this ad? I'm sorry, why should I take this plan that's advertised? It's so much less expensive than PEB. What I would tell you is two things. One, make sure that you know the overall cost, because it may end up costing you a lot more than just the premium amounts over the course of a year. And the second thing is, if you take a commercial Medicare plan, you lose your PEB eligibility and you cannot come back. So let me repeat that. If you take a commercial Medicare plan rather than a PEB plan, you will lose your PEB eligibility. A commercial Medicare plan is not one of the reasons for deferring your PEB coverage. So if you take a commercial Medicare plan, you lose forever your right to come back to PEB benefits.
Ellen?
Yes?
So I want to ask a question that's a nice complement to what you just said. So a member asks, if a member keeps their PEB medical plan but elects an open market dental plan, can you still go back to the PEB dental plan in another year?
Yes, you can. As long as you have PEB medical coverage, what we're talking about is you cannot have a commercial medical coverage Medicare plan and still retain PEB eligibility. So again, you can defer your PEB coverage altogether as long as you meet all the rules, but you cannot use a commercial Medicare plan for medical coverage. You cannot use that as a reason to defer your coverage. You can, however, have a PEB medical plan and choose a commercial off the market dental plan and still retain your PEB coverage.
That's true.
Here are some resources. Lori has many more resources, and I strongly suggest that you refer to her documents as well. But here are some quick things, and included is the phone number for United Healthcare, but all of the plans have phone numbers, and I can provide that for Lori as well. The number for Sheba is on here, and PEB customer service. Just a note about PEB customer service. you know, these are the folks that answer the phones. They are your first stop for information about retiree coverage. But during open enrollment, they have lots of different jobs that they have to do, and the wait times can be very long. So if you have any questions in the next week or so before open enrollment starts, remember open enrollment starts November 1st. Now's a great time to try to ask those questions of the PEBB customer service.
Perfect. Ellen, is this a good time to pick up some more questions?
One more slide, Lori, and then it is.
Great.
This
And I just
is-
want to share with everyone, Derek has put some important contact information in chat. And then just once again, Ellen's slides will be available. This presentation will be available on the guide to open enrollment that you'll find on the RPEC website, and Derek's put it back in chat. And we also want to encourage you to watch the 3-part series that we've referenced with Sheba. So the questions that you are putting in chat, we'll pick those up in just a moment when Ellen finishes her last frame.
My last frame is simply, again, the HCA PEBB Medicare email box. I strongly encourage you to use that if you have any questions, specific situations, anything that you have concerns about, and I guarantee you, you will get a prompt response.
So Ellen, this is an easy one. I think I know the answer, but I want to have everyone hear it from you. If a person is pleased with the plan that they've chosen in 23, do they need to do anything if they continue to want to remain with that plan for 24?
So great question. We have what's called passive open enrollment. So if you are happy with the plan that you were on in 2023, you do not need to do anything to be on that plan again in 2024.
Perfect. Okay. Let me try to pick up some of these questions, and I'm going to have to scroll through our chat, and I will get them. So please be aware that I will pick them all up. Just give me 1 second here, and I'm going to go back to an earlier question. Okay. So this is a comment from one of our members, Ellen. It's something you and I have talked about, but a member wants to just share once again that there's interest in keeping the UMP Classic Medicare in its current structure, and recognizing that other options may be available. So we just want to share that again, that we have members who want to see the plan remain as is, and that would be in addition to the more affordable option that may be proposed in the future by HCA PEBB.
It's something worth exploring.
Okay. Okay, for Medicare covered services, are the required pre-authorizations for the PEBB plans identical? Or can the plans require pre-authorization beyond what Medicare requires? And if the latter is true, are lists available? Let me see here. Are lists available showing which plans require pre-authorizations?
So for medical services, the pre-authorizations would be limited to what Medicare requires. So they would be the same for all the plans. For pharmacy, because the MAPD plans include Part D, and that's the only Part D plans that are available in PEBB right now, there are prior authorizations that might be required for Part D that are not required for prescription drug coverage in the other plans that offer creditable drug coverage. And if anyone is curious, from the UHC website, you can find a list of the drugs that are covered and whether there are prior authorization requirements, quantity limitations, or whether step therapy is required.
Thank you. Okay, I have a question from a member here, and then I'm going to ask also a question that came by email. to Derek and I, okay? So this question from the member is, I understand that there is legislation being proposed in Olympia that naturopaths will be considered as MDs due to the shortage of doctors. If passed, how will this affect affect insurance plans?
So right now, the MAPD plans and UMP cover naturopathy the same as they cover providers, other providers, in the sense that they can be your primary provider. There are some limitations. Let me just go back to, there are differences in the copays that the plans have for naturopathy. But right now, everybody except Primera Plan G covers naturopathy. It would have to be a Medicare decision at the federal level to cover naturopathy as a primary care physician for Plan G to be able to cover it.
Okay, the next one is related, Ellen. This came in email to Derek and I. Which plan best covers preventative providers such as naturopaths, acupuncture, massage, chiropractic, etc.?
So I don't have the comparisons here for chiropractic, acupuncture, massage, but all of the plans except Primera Plan G cover those. They cover them at different rates, and I would suggest that you look online at the plan comparisons that we have to find out the different copays, et cetera, for the different plans.
Thank you. Okay, the next question is in a different direction. What are the advantages of PEBB coverage for a non-Medicare spouse of a Medicare retiree?
So let me take a minute to talk about non-Medicare retirees. So a non-Medicare retiree is somebody who has retired from service of whatever kind. They don't have an employer anymore, and they are not yet 65. So unfortunately, those people do not have the benefit of an employer contribution because they're no longer employed. And they don't have the benefit of a Medicare explicit subsidy because they're not yet 65, so they're not on Medicare. So the coverage for them is very expensive. And the way that HCA deals with that is we have what we call split accounts, where one person is in Medicare and the other person is not in Medicare. For the person in Medicare on either the PEBB Balance, PEBB Complete, or Plan G, or UMP Classic Medicare, the non-Medicare person would go into the the Uniform Medical Plan non-Medicare. So it would be UMP Classic, but not UMP Classic Medicare. It would be UMP Classic. For the Kaiser plans, it depends on which Kaiser Medicare option you're in, what area you live in, and what non-Medicare plans are available. The non-Medicare retiree can take advantage of any of the plans that are available for active employees. But the cost is very different. Again, non-Medicare retirees do not have the benefit of either an employer contribution nor the Medicare explicit subsidy. So the coverage is very expensive.
Great. So we have a member that has asked if you could walk us through the process if you wish to make a change in your plan selection.
So for open enrollment, the process is relatively easy. The forms have to be filled out, but since I am not an enrollment expert, I'm not going to tell you the process because I don't want to make any errors. So I'm going to suggest that you contact PEBB customer service and they can walk you through exactly what needs to be done. I will just say that the forms are available for download now on the HCA website. Form A-OE is the general enrollment form, but if you're changing from one plan to another, you might need another form. So that's why I suggest that you contact PEB customer service.
And I just put that in chat if I captured that correctly. Okay, so we have a, give me just 1 second here. So a member asks, what happens if a member continues with UMP and as the year passes, cannot continue to afford the premium?
So in the middle of the year, they no longer can afford the premium.
Yes.
Unfortunately, the decision of plan is for the year.
Okay.
So unless there is a qualifying event that allows you to switch in the middle of the year, you would not be able to switch.
Okay. All right. We've had this asked before about, well, actually, this is a different question. Do you have data about medication pre-authorizations, denials, and appeals for each plan? We had kind of a similar question that came up earlier. Ellen,
So
do you wanna-
again, you know, that's related to Part D plans. We do have information on Part D plans, and we do have information on UMP in terms of appeals of prior authorization required on medications.
Wonderful. Let's see if there's anything else here.
I do see a couple of hands raised, so.
Okay, I just thought we'd kind of get through these here. Would HCA or PEB be willing to advocate on our behalf with large providers such as the Family Care Network who are unwilling to work with UHC? They may be able to more effectively describe the differences between our group MA plan and the commercial plan. Perhaps these providers don't completely understand the difference.
That's
Ellen,
very
that relates to something
true.
discussed earlier.
Yeah. Unfortunately, unless, again, family health was never, or family care, whatever its complete name is, was never in network with United. So there's no direct contracting that's going on there. So there's no place for HCA to really intervene on that.
Perfect. Okay, this is a very interesting question. We talked about traveling, the portability of the plans when you're out of the country. So there was a discussion earlier, if you live outside of the United States for more than 6 months, you could lose Medicare coverage. But if a person wants to travel to Europe for a year, does that person lose Medicare?
If you're going to be out of the country, that's a great question for Medicare, to contact the Social Security Administration directly, because I think it depends.
Okay. So we've had these questions before about the denial rates and appeal rates for UHC. And Ellen's covered that a couple of times. You might find something on their website. Okay, I don't know. Let's see. It looks like Derek's responded there. Thank you, Derek. Okay, what are requirements for being eligible for the PEB UMP retiree plans?
You just have to be eligible for PEB retiree coverage. And I would suggest you look at the HCA website to see what the requirements are.
Okay, I think we are caught up on chat. So let's go to our participant list. I see Aruna's hand raised. These may not be in a specific order, so forgive me. Aruna, do you want to start? And then we'll go with Stephanie next.
Thank you very much for a very informative presentation and answering all the questions. I would like to know, you gave the list of customer service for UHC and UMP and such, but not for Primera. Is there a Primera customer service? Because Medigap plans are also equally useful to the retirees. And I didn't
Yes,
information.
yes, there is absolutely a number, and I will get that to Lori so that she can pass that on.
And we'll
Okay.
put
I
that on the,
apologize for not having that.
yeah, thank you. And we'll put that on the guide to open enrollment. So that's a dynamic website page that Derek Van Spoor, our associate director, created for us. And it's a great place to just kind of a one-stop. You just go there, and we've pulled many of the important links that Ellen and her team has on HCA. So I think it will be a good place to start anyway with your questions.
Okay, thank you. Another question I had was like UHC Complete and Balance, United Healthcare Complete and Balance is supposed to provide all the Medicare approved services just like the original Medicare would do. But in one of the listening sessions that I was sitting, out of 10 participants, there were 2 participants who had struggles and issues with pre-authorization and denial, and then after processing further, and especially the struggle is when you're feeling so sick and sitting in the hospital, you don't have any energy to make phone calls and deal with the customer service and all that. So do we have information about United Healthcare Complete and Balance as to what are their denial or delays in terms of approval of the medical procedures and the testing, as well as for the prescriptions? Thank you.
Yes, Aruna, a lot of those are specific situations. And I think that I was at the same listening session and heard that specific situation. That was a terrible situation of a number of things coming together at the same time. Unfortunately, there was a particular incident there, but generally speaking, I have not heard of a higher proportion of denials or delays in United than any of the other plans.
And I just want to acknowledge there was a comment made in chat earlier, and this is a persistent concern by our RPEC members about denial rates with UHC. And just know, RPEC members, in the listening sessions, those concerns were communicated to HCA. So Ellen just referenced the one session in Aruna as well, but that came up in other sessions. So thank you for sharing that. We had another participant that also
Stephanie
had
has
their,
her.
Stephanie, yes, would you go next, please?
Thank you, I will. And again, my deepest appreciation for this presentation. It's actually amazing that you can keep all of that in your brain and answer so succinctly. So I'm coming back to this question as my spouse, who also has very serious medical condition, who's under 65, who's waiting to get approval. She's disabled. She's waiting to get approval for Social Security disability, which takes a few years usually. So I want to compare apples to apples in some way. And right now it costs and it will again, probably about $850 a month for her coverage with me as the Medicare eligible one. I just want to compare that to what's the average. I mean, I know I can Google that, but I don't, is it in your experience much less than non-Medicare spouses going to the commercial?
There may be, Stephanie, I'm not trying to put you off, but I would say if you can get in touch with me, it may be more advantageous for your spouse to be on different coverage in the interim until she becomes Medicare eligible. And I'd be happy to walk you through that.
Okay, great. And I'll get your email address from
The HCA PEBB Medicare address is fine.
Okay, thank you. Appreciate that.
So Ellen, I'm going to go back to a question. You answered it, but the person asked a follow-up question. So there was a question you responded to earlier about whether a person was eligible for PEBB UMP retiree plans. The follow-up question is, would you qualify for a PEBB retiree coverage if you were enrolled in PEBB healthcare for 1 month? So it sounds like, I don't know, Renee, do you want to speak to that briefly? I don't know if that's enough information for Ellen to respond. Okay.
The person who has that question can send an email to HCA PEB Medicare. I have to look at the specific situation and find out, Lori. I just can't address that here. Sorry.
I think we have covered all the questions in chat in one form or another. And I'm only seeing Aruna with another hand raised. So Aruna, you want to go next?
Yes, thank you so much. Thank you, Ellen, for sharing the information about licensed marriage therapists being approved by Medicare for mental health support to the Medicare eligible individuals. If we can make this information available to the retirees that this change is happening, and if we know about the people who are contracted to provide these services, list of people or something in the area, at least by region or whatever information we can provide so that people can access the information, because mental health needs are for all ages and especially retirees. So any additional information you can share would be greatly appreciated. Thank you.
I appreciate that, Aruna, and we will definitely put up information about licensed family and marriage therapists. However, we would not have a list of all the providers. HCA doesn't have access to that.
Thank you, Ellen. Okay, we've got another question from Jose.
Yes, well, I want to thank you for the great presentation, lots of information, lots of useful information. I've read recently that through the legislature or through negotiations with staff, I'm not sure, but that there were some instances where retirees that did not take advantage of the healthcare benefits when they retired and therefore lost them, they couldn't come back in, that there have been some efforts to bring some people back in. Are there going to be more efforts like that? My wife is a state retiree, but because of her particular circumstances, she didn't elect the insurance and therefore she came onto mine. But it would be a big benefit for us if she could get somehow buy back in, become a member of PEBB.
So, Jose, you're referring to a very specific Senate Bill 5490, I believe is the number. Lori, please check me on that because I'm not exactly sure.
Yeah, I think so.
And that was for people who had not deferred, but had been denied for not deferring and then had appealed that denial within a specific time frame. So it was a very limited number. I think it was just a couple of hundred who qualified under that particular legislation. Any other change would have to come through the legislature.
Okay.
Thank you.
I want to just share with you, I'm writing some things right now in chat. You'll see in chat that we've provided again the link to the open enrollment page. I don't see any more questions in chat. I also don't see any more hand raised, and we still have 2 minutes to go, Ellen. Nice work. I'll give this just a minute. So I know that someone just put in chat about the rising costs and concerns with UMP Classic Medicare. We know that this is a concern for many of our members. It continues to be a leading plan of choice because it's comprehensive and has excellent customer service and excellent coordinated care. And please know that RPEC is committed to ensuring that this plan remains in the mix. And we're also working at a federal level to try to see if we can make this plan more affordable. So please know it's one of our top legislative priorities. And we appreciate that HCA also is aware of the importance that this plan has for our members. So we thank you for them listening and understanding, and we also appreciate their efforts to look for affordable options that have benefits that are equal to or greater than that of UMP Classic Medicare. And that came from a proviso that RPEC and our coalition had requested of the legislature. Okay, so
I just want to make a note. Aruna put in the chat that HCA should put in a bill on dental. We can't actually operate that way, just so you know, but certainly RPEC can lobby the legislature for better dental coverage.
yeah, thank you. So we're at time. Ellen, there's been a lot of nice comments in the chat about your thorough presentation. We really appreciate the time you've invested and allowing us to ask questions as they came up. I appreciate everyone here coming equipped with good questions and being patient with Derek and I as we've tried to monitor chat and hands raised. I do want to draw you again back to the resource page that Derek developed that's on the website. We've really tried to make that very comprehensive so that you can just go there and click. The links were provided by Ellen. We applaud HCA for being way out in front of open enrollment this year and being so responsive to the feedback they received in the listening sessions from all of you. If you have not had a chance to watch the 3-part series, I will tell you that it's very well done. It provides good information. It's a good complement to Ellen's presentation today. So you can watch those those webinars at your leisure. And for our presidents who are joining us today with our chapters, this also might make some interesting programming for your members who might be PEBB eligible, and that's, in making their choices during open enrollment. So a lot of good information out there at your fingertips. And this presentation will be available on the Guide to Open Enrollment page that you can find on the RPEC website as soon as you go there. And Ellen's presentation will be there and all the other resources. So there's no other questions for Ellen. We are at 12:01. And
Thank you so much for the opportunity, Lori. I appreciate it.
Well, thank you. We really appreciate your time and your patience to get through all the questions. And this has been a remarkable presentation and information sharing, and it's a lot to absorb. But we start with good information, and we appreciate HCA being way out in front this year and sharing the information in advance. And the tip that Ellen provided is an important one. So if you come up with questions, this is a great time before open enrollment begins to make those calls, because we know there's long wait times for either reaching HCA call center or the call centers associated with the different plans. So that's another reason why RPEC put up our website many weeks ago, and we've been promoting this week after week after week. We hope that this lead time will help you to make a decision well before the deadline. Okay, well, thank you. Thank you all. You have a wonderful rest of the day. And Ellen, thank you again for your help.
Thank you so
And
much.
expertise.
Take care, everybody.
Thank you very much.
Bye, everyone.
Bye.